COVID-19 was really the backdrop to this U.S. election, from the record-breaking cases across the United States to battles over reopening the economy. It has been a very serious issue since the start of this pandemic, and Joe Biden has pledged to take it seriously even before he takes office. With more on that, I'm joined by CTV News infectious disease specialist, Dr. Abdu Sharkawy. Dr. Sharkawy, so glad you could be with us on this Saturday night. So there are reports that Joe Biden, President-elect Biden, is going to be introducing a 12-person task force on Monday to tackle this pandemic. What are the first things that he needs to do that haven't been already done?
Well, first of all, I think he has to restore some degree of credibility that the medical experts and the important institutions, such as the CDC, were essentially dispossessed of by the Trump administration throughout this pandemic. There's been nothing short of willful obstruction to frank denigration of people like Dr. Fauci and the CDC in terms of being able to provide helpful public health recommendations and guidance to the American people. And I think first and foremost, it's very important to reestablish that. I think that it's going to be very important thereafter to try and ensure that testing resources are applied to areas of the United States that are more heavily hit by this pandemic. And there are many that are still raging out of control, unfortunately. And I think that very importantly, with respect to restrictions that need to be put in place in terms of the economy and a lot of other institutions that the Trump administration was only too happy to ignore to the detriment of the pandemic, I think I can certainly see there being an opportunity for President-elect Biden and others to focus on a more thoughtful strategy when it comes to imposing those restrictions, particularly in areas that are more hard hit.
Yeah, and every state has done something different, and that has been part of the problem. So how important is it to have a national strategy? And I'll add to that question, how do you get everybody on board when we're 8 months into this? There are a lot of people out there, especially in the United States, that believe Donald Trump when he said it wasn't really a thing, it wasn't a real virus. Then he got it, and then he said it was going to go away. So does there need to be an agreement across the whole country about what tackling this virus will look like?
Well, the simple answer to that is you lead by example. Throughout this pandemic, it's been very clear if you dissect the anatomy of the Trump administration's response, it has been an abject failure from the beginning in terms of willful concealment of the threat that was impending, to frank dismissiveness when it comes to public health guidance, not taking masking seriously, holding large rallies, and eventually having outbreaks throughout the Republican Party's ranks. And when you see the president himself being diagnosed with what could have been a very life-threatening situation, instead of it offering a moment of sobriety and reflection, humility, compassion for all of those who died of this virus and are still very direly affected by it, he doubled down and essentially dismissed it yet again and determined that this wasn't an issue. I think you're going to see a complete reversal in all of that with President-elect Biden. I think that it's going to be apparent that there is a sincere commitment to taking this seriously. And I'm hopeful that the American public will start to pay attention to that modeling and that type of example going forward.
All right. Dr. Sharkawy, stay with us, please, because I want to bring into this conversation Stacy Hawkins. She's a professor at Rutgers Law School. Professor, glad you could be with us. We got you connected. I want to ask you about what you are watching for Joe Biden do when it comes to tackling this virus, even when he's not yet in the Oval Office. And we have seen this take the lives of over 200, this virus take the lives of over 200,000 Americans. What is the first thing that he needs to do once Monday comes and he gets this task force put together?
I think that what President-elect Joe Biden and Vice President-elect Kamala Harris have said that they will do is to confer with the doctors and other health professionals, something that President Trump simply was not willing to do in large measure, at least in terms of dictating the policy for the United States
Not
response to.
undermine the science.
That's right.
Oh, sorry, go on with your thought then.
Oh, no, I just think that they're going to meet with the health professionals and the scientists and determine what the best strategy forward is. He's already indicated that he's going to keep Dr. Fauci, who's one of the most respected epidemiologists, talking about what we ought to be doing on for his administration to lead our efforts. Hopefully, he will look at the pharmaceutical companies that are in the last stages of trials for a vaccine and put together a plan for deploying those vaccines in an efficient and timely manner so that we can get this behind us and move on to the much more pressing issues that we have to tackle in this country.
How big of a challenge is it going to be to get everyone to comply with the guidance that we do here in Canada before that vaccine arrives, which we're expecting in the first quarter of 2021, but still that's a ways off?
I think part of what's going to help is that there's going to be national guidance from the office of the president, something that we did not have under President Trump. President Trump not only dismissed the significance of taking those safety precautions, but he left it to individual governors who also then oftentimes dismissed the necessity of taking those precautionary measures. But when we have President-elect Joe Biden in the office, we're going to have someone who very strongly believes that we have to have national guidelines about what's recommended, if not required, in terms of these precautionary measures. And I think that leadership from the top is going to make a huge difference.
Dr. Sharkawy, let's bring you back in here because I think that there is concern as we go into winter. We're already talking about the flu. Not everybody has been vaccinated yet, been able to get vaccinated. Is there, I don't want to say is it too late, but how much catch up is there to do at this point?
Well, there's an enormous catch up, but it's never too late to try and prevent further harm. And I agree that the most important thing here is having some degree of national unity when it comes to the respect and legitimacy that's offered to people like Dr. Fauci and to the CDC and to public health guidance that has been obstructed willfully and continuously through the Trump administration during this pandemic. There can't be something here that is driven by politics or by hyperpartisanship. It's going to have to be driven by science and by epidemiology. And if we allow the medical experts to provide the necessary guidance without being obstructed repeatedly and turning this into a political fiasco every other week, I think there's an opportunity for people to gain some semblance of confidence and security in the messaging that they're hearing. And hopefully over time, that'll translate into some degree of success. But make no mistake, there's going to be a long layover of people who've already been harmed by the massive misinformation campaign that has been dealt by the Trump administration.
Professor, how do you think history will judge President Trump's handling of the coronavirus?
I think history will judge him by the numbers. And at this point, there are over 250,000 Americans dead, and we are hitting new peaks of cases and hospitalizations every day. And I just think you can judge that as nothing other than a complete and abject failure.
All right, we're going to leave it there for tonight. Stacy Hawkins and Dr. Sharkawy, I thank you both. Really appreciate you being part of our coverage tonight.